It is a rare genetic disorder. It affects about 30 to 50,000 people in the U.S. The condition involves the growth of tumors along nerves. It can cause pain, mobility issues, and changes in appearance. Dr. Angela Herbie is the director of the Adult Neurofibrosis Clinical Program at Washington University, and she's with us this morning to talk more about it. Good morning to you.
Thank you.
Yeah, so tell us about this disease.
Yeah, I mean, first of all, thank you for having me here. I'm really excited to partner with SpringWorks in order to try to bring attention to neurofibromatosis type 1 and plexiform neurofibromas. It's a mouthful for sure.
Yes.
But it is actually the most common tumor predisposition syndromes. Like you said, it actually affects about 120,000 people in the U.S., and about half of those patients will have these plexiform neurofibromas, which are very large tumors that can happen anywhere in the body. And they involve multiple nerve roots. So they can be very, very painful for these patients. They can be disfiguring. And depending on where they are, you know, they can actually cause organ damage by pushing on the organ. So they're a big problem for these patients.
Yeah, well, what can parents look out for? I mean, what are some of the symptoms?
Well, the big things are pain. Most patients that have the condition, know to sort of be on the lookout for the different tumors that they can have, but many of them you can see just by looking at a patient. So that's why I can say they can be very disfiguring. Their face can be completely deformed, or one leg could be twice the size of the other leg because of these large tumors. So it can even make things like wearing clothes difficult.
Yeah. How do patients manage the disease?
Yeah, so historically, we really had to rely on surgery. And even with surgery, more than half of these tumors would actually just grow back. And obviously surgeries come with risks. In 2020, there was one drug that was approved for children with NF1 plexiform neurofibromas. But excitingly, in February of this year, we finally have a medication approved for both adults and children with these plexiform neurofibromas. So Gomekli, or mirdametinib, is this medication. And it's been shown to shrink these tumors significantly in the clinical trials that have been done, and also really improve patient symptoms. Every medication comes with side effects, right? And the most common with this being an acne-like rash, but that usually resolves over the first couple months. And then nausea and diarrhea are kind of the other big things that can happen.
Yeah, if someone is concerned about this, where can they go for more help?
Yeah, so there's a lot of information that you can find at gomekli.com. It's GOMEKLI.com. I think another really good resource for patients is the Children's Tumor Foundation website. This is the national foundation that offers support and resources for patients with neurofibromatosis type 1.
All right, Dr. Herbie, thank you so much for your time this morning. We appreciate it.